Hello and welcome to The Wire. You are watching Graphiti. My name is Tania Roy, and with me is MK Venu, founding editor of The Wire, who writes on business and political economy. It's been 5 years since the Ayushman Bharat program was launched. With the help of data and graphics and analysis, let's review what is the efficacy of the program. So, Mr. Venu, what do you think about the Ayushman Bharat scheme? It's been 5 years and lots of questions has been raised on a lot of things, including data loopholes and a skewed hospitalization, everything.
So it's very clear that what Prime Minister Modi projected as his own version of Obamacare, what he described as Modi Care, when he launched the scheme in 2018, it's now 5 years, and the outcome, the results are pretty embarrassing. I would say you can't even say it's mixed, because there is so much that needs to be done. One can understand the logic that every scheme takes time to mature, but Prime Minister Modi keeps claiming his great expertise at building speed and scale. Now, I would like to judge the scheme, since it is named after the Prime Minister, on the metric of speed and scale. On the metric of speed and scale, I think it has miserably lagged. And I'm not saying this. So that's why I've got this little article which was written by the first CEO, founding CEO of Ayushman Bharat scheme, Mr. Indu Bhushan. He wrote in Times of India just a few months ago about the scheme and its, success and failures. And he talks about challenges that the scheme faces after 5 years. Mind you, after 5 years, what are the challenges? I'm quoting him. He says, the first challenge is the database for identifying beneficiaries. Just ask anyone familiar with the scheme who is eligible for PMJAY, Prime Minister's Jan Arogya Yojana, Ayushman Bharat. You will get a long and incoherent answer. The scheme relies on the 2011 socio-economic caste census, an outdated database. The first CEO of Ayushman Bharat is saying this. So what does this tell you? That they don't even have a proper database.
Right.
They are still using an outdated
database.
Again, Indu Bhushan's words, CEO's words, not mine. Outdated database, 2011 caste census, and they have decided not to do the 2021 caste census, socio-economic, the 2021 census,
Yes.
which would have given them a more updated database. Then he goes on to say that complicated eligibility criteria, poor data quality, and exclusion of a substantial number of deprived population have created frustration among implementers and communities alike. And this captures actually the state of Ayushman Bharat. And if you read this along with the CAG's observation,
Yes.
recent observation, then you cannot but conclude that it has performed way below par. And that is the best certificate that I can give Prime Minister Modi at the moment on Ayushman Bharat. It has not, which the CEO also says, it has failed the expectations and the aspirations of large sections of the population who were supposed to get benefit, and they have not got benefit under this. And the most telling example of this was in July 2021, an RTI was filed by India Today Group, and they found that in UP and Bihar, in UP barely 800 people or 870 people availed of the Ayushman Bharat insurance scheme. In Bihar, it was even less. It was double digits, some 650 or 60.
It was 19 people, I think.
Yeah,
out
19
of 11
people. Yeah.
crore.
Imagine, in a population of UP is 240 million, Bihar is 150 million. And if you take them together, you have a strike rate of, if you take UP Bihar together, 300 400 million people, UP itself 240 million. You have a post-COVID, you have a strike rate of, I don't know, it's 0.00001%. I mean, whereas this is supposed to benefit at least close to 40% of the population,
True,
overall, yeah.
Right.
So this is the state of the scheme. Yeah.
And even a lot of people, especially big hospitals, have been talking about the low premium.
Yeah.
Mostly they are saying that with such a low premium, how can you offer quality healthcare?
Exactly. Yeah.
So, how does Ayushman Bharat work with such low premium amid high inflation? India's medical inflation is at 14%. It is double the retail inflation, and even increasing healthcare costs have pushed millions into poverty. So in that scenario, how does it work? Such a low premium, high inflation, and a promise of quality.
So
healthcare.
the question that you ask is very relevant, because this then goes back to the debate about the allocations. Originally, when this scheme was launched by Prime Minister Modi, saying that this is India's Obamacare or Modi Care,
largest healthcare scheme
largest
in the world.
healthcare scheme in the world. It was showcased. Mr. Modi talked about it abroad, etc. Whenever he travelled, 500 million people, and the premium budgetary allocation at that time, experts said minimum 1 lakh crore a year. But where are the allocations? Allocations are, I mean, a third of that. Less than probably a third of that, and that explains the poor quality of the services that which the CEO of Ayushman Bharat, Indu Bhushan, talks about in this article.
Okay.
He says that quality has been poor, the quality of infrastructure, equipment in most states. There is no supply, and the CAG also confirms this. CAG says that among the empaneled hospital healthcare providers, many of them have fallen off the chart because they cannot, probably because of
the low
affordability, and many of them, especially in North India, the supply of hospitals, good doctors, quality equipment is not there at all, and North India is it is really showing in a very stark way, as the data post-COVID showed, because in South India post-COVID, many states had a reasonable numbers of people availing of Ayushman Bharat. In some Tamil Nadu, say Kerala, Andhra, upward of 40,000-50,000. So people. So this is the nub of the problem. You announce a scheme. As is the habit with this government, you may take you talk big. You get great publicity. 500 million people, biggest healthcare scheme, and the final, when you see the performance after 5 years, which is not by any means short period of time,
was expected,
especially since Mr. Modi says speed and scale, performance is pretty pathetic. I would say. In fact, here the Indu Bhushan, the CEO, again says another big challenge is that the north and the eastern parts of the country do not have enough quality hospitals to address the demand that Ayushman Bharat seeks to release. Now, this do not have enough quality hospitals is linked to what you're talking about. Low premium, there's no budget, government budget, and many hospitals who are empaneled have withdrawn. Because they don't find, probably they don't find even their costs getting recovered on the existing premiums. So and of course the third challenge that Indu Bhushan talks about is the variance in implementation capacity and commitment to the scheme across states. So obviously southern states have done much better because southern states already had a reasonably good healthcare infrastructure framework even before Ayushman Bharat was implemented, and this has been brought out by the former Health Secretary Sujata Rao. Andhra Pradesh already had one Arogya scheme where they used to cover 60-70% of the population. Tamil Nadu already had, Kerala had, Telangana,
West Bengal,
Andhra,
Rajasthan,
Karnataka, they all have had decent schemes, and they in fact, I was talking to a high-ranking official in Tamil Nadu and Karnataka, and they are telling me, if you look at data, you might find the number of people who are getting facilities under Ayushman in those 3-4 states, either Ayushman or their independent schemes. States are running independent schemes also, and they are taking, in some way, they are trying to connect it with Ayushman. It will be much more than what you see in rest of India. And in this context, I must bring out this stunning data, which was brought out by Niti Aayog. 65% of the hospitals in the country cater to merely 7 states, and 35% cater to the 7 or 8 states, to the remaining 21 states. So imagine the skew. 35%
Yes.
of the hospitals catering to
35% to the rest of the.
No. I'm saying 35% of the hospital catering to some 21 states.
Oh, 35% to 21 states and
65% to 7 states.
7 states.
And most of the states are in the south.
Okay.
So you see the you see the problem. You see the huge inequality gap between north and south.
And also, as per data, most of the hospital Ayushman cards have been distributed in 5 states: UP, MP, Chhattisgarh, and 2 other states. But the hospital admissions in these states are the lowest. In contrast, in southern states, the Ayushman cards have, most Ayushman cards have not been distributed in the southern states, but their hospital admissions is higher. So this shows that South has a better healthcare infrastructure.
Massively.
In
fact, this point has been made by many health experts, care experts, that in the South, women are literate. The general literacy is high. Their per capita incomes are higher in the South. And I'll give you another data which was brought out by an equity research company, which only yesterday they brought out a report, Marcellus. It says that the per capita income of the southern states is 50% more than the rest of India. Per capita income of rest of India, 50% more. So, and more literacy. So, and better infrastructure, better run hospitals.
Yes.
And better run schemes. I'll give you one example. In Tamil Nadu, nearly 98% of the delivery of children among is 90% is done in primary healthcare centers.
Okay.
I cannot imagine this happening in the North Indian states. I cannot imagine this happening in UP, Bihar, Madhya Pradesh or Rajasthan, because it is the district hospitals or primary health centers do not work so efficiently, which was very visible during COVID also. Yeah.
So basically, before introducing such a
so if you ask me, I'll say, if you ask me the performance of Ayushman Bharat scheme in the north, it is abysmal. I would say in the south, reasonable. So these people will highlight the reasonable performance in the south, which is already doing well. In their own schemes, they were doing well.
Yes.
Before they were running their own insurance schemes and they were doing well. But where it needed to sort of at least provide some succor, some relief, it has not provided. And Indu Bhushan, the CEO of Ayushman Bharat, recognizes this, and he says that the performance implementation across states is very, very skewed.
So basically, the government maybe should have first focused on building a proper healthcare infrastructure before introducing such a big healthcare scheme and solving these data loopholes. Because see, according to the CAG report, many of the Ayushman cards have been linked to a single number, and many patients have been many eligible beneficiaries have been availing of benefits in the name of dead patients, and crores of claims have been released in these cases, and these are public funds.
So the Indu Bhushan answers that question also. He says that claims take time to materialize. By then the person would have died. But he comes up with a very, I would say, funny reason for why over 7 lakh people gave the same telephone number. I'm interested. So people thought it was some big fraud had been committed. He says it is not a big fraud.
Okay.
It is because those people didn't have telephone numbers, and the software which the Ayushman Bharat scheme was using needed a telephone number for proper follow-up.
But that
So which
increases
means, I mean, didn't they realize that the very poor may not have phones?
may not have phones,
Yeah,
right?
I mean,
And this also increases the scope of fraudulent
of course,
activities.
he says in the end,
Huh.
there is a need to curb frauds and abuse of the scheme. And there's massive instances of fraud and abuse in the scheme. And so at the starting point itself, the way they designed the scheme, they were in some la-la land and they thought, oh, everybody will, bottom 20% of the population, everybody will have a phone. And then they found that people didn't have phones. They didn't have, requisite, they didn't have requisite, they didn't have the wherewithal to get on to to connect with the software and the feedback system,
Yeah.
online feedback system. So that's a small part of the problem. But the bigger problem, as he himself says, the CEO, no database.
No database.
You're going by the 2011 socioeconomic caste census,
Yeah.
and this government has stubbornly refused to do the 21 census. Every 10 years we have a census. Since independence, this is the first time a government is refusing to do census, and all this is driven by political considerations. You see how everything is determined by politics, elections, caste. How if you do a census, then there might be the whole the new database on OBCs will create problems. These people in their anxiety to only focus on the next election, they're not they're letting all these schemes languish because of lack of census.
And it's also a question about who is actually benefiting from this scheme. Is it the poor man who has been promised quality healthcare? Is it the insurance companies? Is it the government? Who is actually benefiting from all this? Because see, medical inflation is high at 14% and healthcare costs are rising. Incomes are stagnant, wages are stagnant, they are not growing. And there was a report by one of the authors from a WHO NSS report said that if we were to redefine the poverty line, including healthcare costs, there would be a massive increase in the share of poverty-ridden population. That's why this topic is very important, because healthcare costs are rising each year, and it's absolutely impossible for a poor man to afford quality healthcare. By promising the common man quality healthcare, the government should also look at the implementation of the world's largest healthcare scheme, isn't it?
Absolutely. That's what again, I come back to Mr. Indu Bhushan. I'm saying this because he was the CEO for 3 years.
Yes.
So, if we say if you say it ourselves, these people will say, oh, you're anti this government, or you don't like these government schemes.
But we are saying the facts. This is the truth.
We are stating the facts. So
Yes.
here he says that the third challenge is the variance in implementation capacity and commitment to the scheme across states. So what is he trying to say? Variance across states meaning, as the Niti Aayog data showed, only 7 states are doing it well.
Right.
So 21 states are still grappling with how to implement this scheme. So you could argue that in say 3/4 of India,
the scheme isn't working that well.
No, it is yet to take off.
It's yet to take
Yeah, I mean, to be brutally candid, it is not taken off in 3/4 of the country, and to the point that you made about medical costs, the inflation medical costs. In India, probably has the largest amount of out of pocket expenses people incur. Both middle income, lower middle, and poor, of course. The poor would maybe mortgage their land or sell their land or whatever assets they have to deal with. So in that regard, if you take the BRICS nations, India's public expenditure in health, government expenditure, is 1.3% of GDP. China is 5% of GDP. Russia, South Africa, and Brazil are 7 to 9% of GDP. You see
very low.
See the gap. And I would say, finally, I would say these are the areas where you need to be a Vishwaguru, you know. You keep saying we are Vishwaguru, Vishwaguru. Where is the,
Healthcare
what
is
the,
basic.
where is your Vishwaguru kind of image in say healthcare or even sustainable development goals under UN? You know? So a lot remains to be done. You know, this is one has to be brutally candid about this. One can't, in the name of giving India, these days particularly there is this narrative that one should not keep criticizing India. India's image suffers. So if you don't talk about these things, then really we're not headed anywhere. You know.
I agree. So that was all for today. Thank you for watching The Wire.